The CECC says it will foot the hotel bill of people who go under quarantine due to an epidemic investigation. The announcement comes as Taiwan ramps up contact tracing to control the spread of Omicron.
The CECC says the policy is retroactive, so anyone who paid for their own hotel stay after December 14, 2021 can apply for reimbursement. An estimated 6,000 people nationwide are eligible.
Workers at Taoyuan's airport are on high alert. Lab tests confirmed 63 new cases of Omicron this week, bringing the tally to more than 800 since the variant emerged. On Friday, officials gave an update on the case of an infected airport police officer. Lab tests showed that this case was not connected to Taoyuan's airport cluster. Instead, the officer was infected with the same Omicron BA.2 variant as that in the Kaohsiung Port cluster, although the sequencing differed. This means that Taiwan now has one new transmission chain with an unknown source, taking the total to 9.
BA.2 这边主要来源国还是以这个
The BA.2 cases here are still largely from the Philippines and India, so we will likely make comparisons with individual cases from these two source countries.
Given the exceptionally infectious nature of Omicron, local governments are ramping up their contact tracing efforts. Currently, local governments can choose to pay or not pay for contacts to go under quarantine. To settle conflicts over the issue, the central government has pledged to foot the bill for close contacts.
From
now until December 14th, if you have been identified as a contact of a case, your additional costs from that will be paid. Whether the local government has already paid or you paid it yourself, the central government will take care of the fees.
Taipei is one city that already covers quarantine fees. Each person is eligible for a 20,000 NT subsidy. Since September, 2,472 people in the city have gone under quarantine, costing the city more than 50 million NT.
Here in Taipei, if you are infected, the quarantine hotel has always been completely free. That's because you are considered a medical patient, so we are taking care of a patient. I see that as an extension of what hospitals do.
The central government said the new policy is retroactive, going back to December 14th last year. An estimated 6,000 people will be eligible for reimbursement.